it's Dr. Tabanay with Central Providence Veterinary Hospital. We're going to talk today about how to give your pet subcutaneous fluids. Subcutaneous is the space between the skin and the underlying tissues. And our cats and dogs have lots of extra skin over their shoulders where we can pack sterile fluids that they absorb into their bloodstream to improve their hydration. The most common time that we use this frequently at home is with kidney disease. So let's just go through the steps. You'll have 3 items besides your wonderful pet. You will have your fluid bag, your fluid line, and then your needle. The fluid bag and the line can be reused, so they will stay attached and you'll use a certain amount that your vet has prescribed for each fluid administration. The needle will be changed each time. So let me just go ahead and open things up to show you how to do it at home. Okay? It sounds like a treat, but it's not. Sweet boy. Nico is not going to be receiving fluids today, but he's a wonderful pet and will show you the subcutaneous space using his cute little shoulders. Okay, usually not that hard to get that off, but there is your fluid bag and then your fluid line. All right, this just simply holds it together. There are protections on both sides of the line when you open it, so these caps make sure that these items stay sterile. When you take the cap off, you don't want to touch what's underneath with any fingers that would introduce bacteria. So when you open it, it doesn't matter if it touches the table or a cute little Nico, but once these caps are off, then we do have to be a little bit more cautious. The bag itself can hang from anything in your home. A lot of people like to use a hanger on a cabinet knob. We'll use our medical IV line pole here. To attach the line, you will first just close one of your options. So this one rolls closed, so that's one way to close it. This one pinches close, so that's one way to close it. But before you attach the line, do close at least one of those. Then we pull the tab out of the bag. Fluids will not go everywhere. There's still a stopper in there. We'll take the top off of this, and then, remember, we're not going to touch that part now, and then we'll secure it and wiggle that in. Next, you'll squeeze this to allow some fluid to start to collect. You'll undo this tip, remembering not to let it touch anything at this stage, and you'll undo the pressure on your line so the fluid will start to run from the bag through this holding tank and through the line. We'll just put some a little here on the table. At home you might have it someplace near a sink or a towel. Okay, so now the line is full of fluid. This is open. We'll uncap the needle. There's usually a little plastic piece at the bottom of the needle. Again, not touching that, not touching this. We'll put these two together. You can also secure the screw top there. So this is still a sterile line. Until you get practiced at it, you might find that you get some bubbles in the line. You do not have to worry a lot about that when we're putting things in the subcutaneous space. If we're putting things into an IV or directly into the vein, then that's a different situation. If you're still nervous about it, you notice that you got a lot of bubbles or maybe a big bubble line here, you can put one of your other sterile needles in this little contraption and fluid will run out as well as the bubbles will run out. So once you see all the bubbles are gone, you take your needle out and your problem is solved. Okay? So this fluid bag is 1 liter. Typically mark it with a Sharpie. So we've got this set up appropriately. Remember, you only have to set up the whole thing when it's new. So if you have a new bag, you set up a new line. But you might use this for 5 different treatments and all you have to switch between is the needle. When we go to treat our patient, Mr. Nico, hello, my tips are to pick up the skin, so kind of pinch the skin. And if he was a short hair, you would see it better, but you're gonna have like a triangle of skin right here. And the needle, we're going to push in at the base of that triangle, and it should be under your fingers. So you're not going to poke yourself, you're not going to go through and through, you're just going to imagine that triangle of skin, poke the needle in parallel to his body at the base of that. So obviously remove the top, pinch up. I think a quick poke is more comfortable for them. It's a very tiny little pinch. And then when that is secured, usually someone is holding this in. You don't want to let go because even with small movements, he could move that out. And then you come back to your line that's now slightly closed and you open it back up again. It starts flowing. You go to your marked line. When you're done, then you come back, you pinch the skin around the needle, you remove the needle, safely put the cap back on. That is the most likely time to get poked, so do be very, very careful. And then just kind of rub in that area a little bit. Sometimes, depending on the amount of pressure that's there, you'll get a little bit of backflow, so you'll get a little bit of moisture on the skin or the fur, but that's just fine. I hope this has been helpful, and thank you for doing this for your pet. Let us know if you have any questions along the way.